dream. Dr. King dream.
I have a dream.
Martin had a dream.
That all men would be guaranteed life, liberty, and the pursuit of happiness. I still have a dream.
Martin had a dream.
First of all, thank you for inviting me to Yearlings Club. A lot of people don't know the history of the Yearlings Club. It's been around for a lot of years. And started Universal Olympic Athletic Club, and it was really to have forums to give back to the community and talk about social issues that impact African people. So, I want to thank elected officials that arrived. I want to thank the Yearlings Club for honoring me to come speak today. I have my family here for one purpose, right? Because our youth are the future, right? And my wife here is support. But before I came today, as we reflect on Martin Luther King Day, I just want to keep in mind the sacrifices, because it's easy for us to live our life, right, and not understand the sacrifices that others have made. And it was a burden. When I was growing up, I often thought if I had that oratorical voice and I spoke out about things that impact African people, then I would die at the age of 25. That's a heavy burden to lay. There is no other race that has to deal with it. Then as I have my kids in the front row, I can't help but to think about another person, Malik Shabazz, as he was giving a speech. And he was gunned down right in front of his kids and his wife. Let's keep that in mind of what people have laid the sacrifice for where we are today. I want to take the time to thank my staff that have came and parked the ball. In 1968, Park the Ball was created. So let's go back in the times of Louisville for people that are here to remember. Park the Ball provided the first health center that actually assisted African people. You couldn't even get to the hospital or call 911 without ambulance service. And Park the Ball provided that. That's an important thing to remember. You couldn't even receive health care, which to me is a basic human right. Basic. It's survival, right? Now, Park the Ball, which a lot of people don't realize, we're on 15th and Broadway. We in Eminence, Henry County, we're in Taylorsville, we're in Newburgh. We're Central High School, we're in PRP. There's a lot of people who need our services. But we understand that healthcare is an essential component of the dream of Martin Luther King. It was his vision. Healthcare is a basic human right. And it should be accessible to everyone. Yet, in the world, we rank 33rd for one of the wealthiest nations in the world. Dr. King's legacy propels me to be vigilant for social justice, constant working on improving beyond healthcare. And I'm committed to dismantling the barriers that do not allow us to heal bodies and minds and address the systematic inequalities that affect our community. I began my career here in 1995, and I worked for the University of Kentucky at the time. And I worked in Shepherd Square, and it was to improve the life of the people that lived there in projects, all the way to Jewish Community Center. And then I started to work at Louisville Metro Health Department. And I saw the inequities that existed. I didn't understand my career path. I didn't understand my mission. But since then, I ran Bullitt County Health Department. I was the first African American there. Centennial remembers. I used to have people call me, telling me not to take the job because I was going to be hanged. And I said, if it ain't me, who will it be? I went to Assembly County, Florida in Sanford, where after Trayvon Martin was murdered, became the first Black commissioner there. And then I moved to Brookline, Massachusetts. And since then, I've did tours, because I'm still in the military, in Senegal to help with Ebola, Iraq to help with Iraqi freedom, and I spent time in New Orleans at Hurricane Katrina. The important message is, throughout my travels, I've seen many people experience racism, not just in healthcare and all walks of life. How I understand the struggle is quite different from many people. What you see now is a product of growing up in Chicago, on the South Side and Inglewood. I've seen communities degraded and decimated. Dr. King had a dream, and he dedicated his whole life to health inequity and social justice for all people. He had the mindset. He saw something I didn't see. And unfortunately, I have seen worse. His experience was dealing with racial justice. What I have seen is degradation of the community that we have never seen before. And even though I am still profoundly honored to stand before you today, to commemorate this day, his legacy, and discuss the pivotal role that we can play now. Because we're talking about an old message. We're talking about a dream. I'm gonna bring that dream to hope, to reality. I want to talk about what we must do to work together. And we must not be afraid. Dr. King's spirit, his enduring commitment to civil rights, his dream of justice and equity in society continue to inspire generations. His words remind us of the arc of war universe is long, but it bends toward justice. Let's continue to celebrate that iconic leader. But we need to reflect on the progress that we have made in the work that lies ahead. Dr. King gave his bravery and his march forward and mentality, but it cost him. But what people don't realize, and I'm talking about to them, it cost him of being a father. It cost him of being a husband. It cost him of not being able to see where we're at today. He paved the way for us to vote, for basic civil rights, and he successfully fought for immigration. But that was a cost. We were not welcome at diners, at hotels, and a lot of other places. His actions and words inspired a lot. But let's fast forward to the present. Because I want people to understand and be clear. Being in America today is a struggle. And let's not fool ourselves. And for many, it's a nightmare. The reality is we are still fighting for affordable housing. We are still fighting to keep families together. We are still fighting for better streets and safer communities. We are still fighting against police brutality. We are still fighting our own internal homicide. I'm going to repeat this again. We are still fighting our own internal homicide in our community. And along that path, some of us has lost hope. We need hope. We need love. I do not know about you, but I do know my wife come to me and wonder the hours of work that I put in. And sometimes I'm tired. I'm gonna be realistic. It is every week. But I know that Dr. King will want us to move on. Malik Shabazz will want us to move on. John Lewis will want us to move on. Megan Evers fought for something. James Baldwin wrote for something. Thurgood Marshall sat on the court for something. I want us to continue to fight a good fight. Even if it might cost us our life. How many people in the room are willing to sacrifice their life? How many people are willing to dedicate their life to a cause that goes beyond them? No matter the race, but to improve the living condition in which we are. And just in case you didn't know about statistics, and I'm an epidemiologist, so I'm sorry, but I can give you that. The African American family structure has declined steadily since the 1960s. What that means, there were more African Americans that were married. There were more two-parent homes than there were before. 60% of African Americans live below the poverty line. 60% of African American women have white-collar jobs. Only 30% African American men. There is a reason. I need everybody to do the research, and it ain't through Google. Affirmative action nor integration has changed poverty, homelessness, food deserts, improved communities, or provided united health care. In fact, what I'm talking about has been exacerbated. And in Louisville, Kentucky alone, African American men are dying 15 to 20 years younger than our counterparts. Our average age of survival is still 56 years of age. But there's a silver lining. Despite these harsh realities, in 1940, 6% of Black women were domestic servants, compared to 2.2% today. So that's a significant improvement. In 1964, 18% of whites claimed to have Black friends. 18%. That number is 87% today. 42% of African Americans own homes and consider themselves middle class. That was part of the dream. But today, let's bring the dream to reality, to hope. As we celebrate Dr. King, let us renew our commitments of ideals and equality and social justice. Let us remember that education, economics, and our environment impact health. Let us remember that health is the essential block of fair and compassionate society. Let us continue to collaborate to ensure that not only the West End is changed, but communities across America is changed. The South Side Chicago, the West Side Chicago, LA, Philadelphia, New York. We need every community to flourish. We need to really rebuild our communities. We need to rebuild our mindset. Because we think we're doing enough, but we're not. We need to rebuild everything that's around us. I need the East End to look like the West End. I need every community to look the same. And it takes all of us together, working together to improve that. And before I close, I want everybody to take a moment to close their eyes. Imagine a middle-aged man who is married with kids, has multiple degrees, and a successful career making of his experience. He owns a home and lives in a beautiful community with top-notch schools. Now open your eyes. That person I'm referring to is not white. As society leads you to believe. That person is me. I've had an opportunity to work in several different communities and lead health departments that have been all white. This is the hope. I am what the dream was supposed to be. And I do whatever I need to do to make that become reality for the future. And I leave you with, if I rule the world, I would change everything to give everyone the dream, the hope, and the reality of a better future. Thank you.